Welcome to the ACOEP RSO Mentorship series on how to succeed in your sub-Is. First, I want to introduce the RSO board. This is our wonderful group of people who have been working really hard to plan the spring seminar. I'm hoping to see you guys there. If anyone from the board is on, which I saw a couple people, please hop on the mic and introduce yourself.
Hi guys, my name's Amber. I'm the GME chair. I'm a third year at Western University.
Hi guys, I'm Sarah Turley. I'm a third year at LMU DCOM and I'm one of the conference chairs. So everyone come to conference. It's gonna be great.
Hi there, my name is Janelle. I am the secretary and I am a second year at Kansas Com.
Yeah, hey guys, I'm Gordon. I'm a student publication chair. I go to ICOM out in Idaho, and I'm excited to meet hopefully most of you in a couple weeks here in Orlando. So thanks for being here.
Upcoming events for the RSO Mentorship series. May 9th is on how to write a personal statement. That lecture is going to be given by Spencer, who's a resident at JPS. He's our vice president for RSO, and this lecture is fantastic. Then in June, we're going to be doing a What I Wish I Knew Before Going into Emergency Medicine panel with a bunch of program directors. And then in July, we're going to do more of like niche advising with breakout rooms into couples match, dual specialty applications if you're going EM/IM, EM/PEDS, anything like that, and some other more kind of small group stuff. So stay on the lookout for those. The June and July, we're going to be partnering most likely with EMRA to be putting on a bigger event. So stay tuned. And then spring seminar, like I already mentioned, in Orlando, Florida, coming up at the end of the month. We hope to see you guys there. And I will pop this slide up again at the end. That way you guys can screenshot it or whatever you need to do. Well, let's jump into it. Congratulations, you have finished round 2 of boards and you're headed off to your first sub-I. That is super exciting, right? It's not like the performance on the sub-Is is single-handedly the most important part of your EIS application, right? Oh, wait. Oh, it is. It is kind of the most important part of your ERAS application. So I hope I got your heart rates up a little bit there. It's going to be okay. Let's all take a deep collective breath. And that's why you're here. You guys are a step ahead of the game. We're going to talk through how to crush your auditions, how to get the good slow, and how to end up at the program you want to be at. So before you arrive, before you end up in the city, wherever you're doing your sub-I, there's a couple things that you need to take care of. First, finish your documents on vSLO and any training modules. So this is an example I already mentioned where I rotated before. This is an example of a lot of the post-decision documentation that I had to upload onto vSLO. Go ahead and knock that out as fast as you can. If you've already been accepted to some rotations, just do it, get it over with. Go get your drug test if you need to redo it, get your titers if you need to redo them. Go ahead and get this done. You'll be less stressed. The coordinator will be less stressed. It'll be good. Training modules, you're going to probably have to do EPIC again. You might have to do some of their like HIPAA compliance stuff. Knock out those training modules as soon as you can. Arrange housing. So there are a couple different websites that you guys can look at. I looked through Furnish Finder and then Rotating Room, the two main websites. These are typically for medical students and nurses who are traveling. So everyone is vetted and they're usually lower priced than like Airbnb or a hotel. So check those places out. They are fantastic. And then big thing to remember, the residency coordinator for the program or whoever they have you as your point of contact, sometimes there's a specific med student rotator coordinator, they are the best. So every question that you have, go through them. They're there to advocate for you. They're there to make your whole rotation, your whole month so much easier, so much smoother. So they are really, really important. And you want to think of them basically as the program director, right? Like you don't want to make them mad because they can easily go to the program director and say, hey, this student gave us kind of a hard time. You might not want to, consider them high up for the rank list when it comes down to it. Things to think about that you might not have thought of are the mandatory scrub colors. I asked all the coordinators that just because some places like the residents have to wear black. So just knowing what to prepare myself for when I got through the door. And then also the residency coordinator who is going to send any time off to. So if you do need to take time off during your rotation, you can. just let them know. And your schedule will kind of depend on the program. Don't expect to get your schedule very far in advance. Some of them, I got it during orientation week and you kind of got to pick your own schedule. So know that you can take time off as long as it's not excessive. I went to a conference during one of my sub-Is and it was totally okay. They will work with you for it. Just make sure you know your dates ahead of time. You made it through orientation and you're showing up to your first shift. Deep breath. You walk through the doors, show up early, like 15-ish minutes early, at least for your couple shifts. Familiarize yourself with the emergency department, okay? Know where they keep the stocks. Where do they keep their flushes? Where do they keep the IVs? Where do they keep the, suture kits? Where do they keep the sutures? What are the door codes to get into all of those rooms? So familiarize yourself with the emergency department because it's going to make your workflow faster. And also your job is to help make the residents' lives easier. So anything you can do for them, like going to get stuff, familiarize yourself with the emergency department. Introduce yourself as the fourth year sub-I. There might be third year rotators on there. There might be home students rotating with you. So specifically introduce yourself as the fourth year sub-I. That way they know who you are. Take notes at sign out. This is a little tidbit that I was given and it definitely made me stand out. So you're going to show up to your shift. You got there early. You're settled in. You're logged into Epic or whatever platform you're using. Get a piece of paper, however you need to take notes to organize. Take notes on everyone, not just the patients that you might be getting at sign out, because the number of times that the attending would ask a resident, hey, what are we waiting for on so-and-so? And I had a note on it and I could just, hey, they're waiting on this. Not overstepping my bounds and not making the resident look bad, but like at the appropriate time and place, maybe the resident has stepped out. If you have notes from sign out, you can say, look how prepared I am. I know everything going on in the department. Set a goal at the beginning of your shift and find out the attending's expectations. So setting a goal at the beginning of the shift looks something like, hey, I really want to get better at EKGs today. Can you please hand me every single EKG that comes through and test me on them? Or I didn't feel so confident in my patient presentations. Can we really make sure I hammer those down today? And can you give me feedback throughout the shift? Giving them a goal makes it easier to give you feedback in the grand scheme of things, because a lot of times, we ask for feedback at the end of the shift and they're just like, oh yeah, you did great. But they weren't really looking for anything in particular to, give you that feedback on. So setting a goal is a great way for them to keep an eye out on stuff and kind of keep yourself accountable to challenge yourself. With that, also find out the attending's expectations. Everyone is going to have their own way of liking to do things, whether that's a specific way that they want to give, they want you to give the patient presentation. Some of them want you to do more chart review than others. Just kind of gauge what the expectation is. That way you can be great for each attending that you're working with, knowing that during your month, you might not work with the same person twice, and every single person is giving you an evaluation at the end of the shift. Go see your patients and offer to write notes. Again, this kind of goes back to finding out the attending's expectations. So on some rotations, you're expected to write notes. On some rotations, you're expected to write notes, but the attending still doesn't want you to write notes. So just say, would you like me to write notes? If you have scribe experience, say from the past, and you know your notes are good, I would even say, go ahead and write the note and then just say, hey, I wrote the note on patient in room 12. If you want to look over it for me, give me feedback. And sometimes if your notes are great, the attending will say, awesome, keep those up and keep doing them, and they'll steal them from you, copy paste, and it makes their life easier because now that's less notes that they're having to write. The EM Fundamentals book by EMRA. I'm going to shameless plug EMRA right here. If you guys are not EMRA members at this point, obviously join RSO, but make sure you also join the other organizations, resident and student groups. So EMRA is the Emergency Medicine Resident Association underneath ACEP, and they send you a welcome box if you join. The EM Fundamentals book, which I think came in my box back in the day, I don't know if it's still in the box, but you can purchase it. It was a lifesaver for my rotation. Every single time I'd go see a patient, especially on my first rotation when I was a little bit more nervous, I had my EM Fundamentals book by EMRA sitting next to me at my desk, and I would open it up and just make sure that like my differential was good. It gives you like what tests to order, all that kind of stuff. And it is very helpful. Chef's kiss, highly recommend it. Don't overstep your bounds. If the resident asks you, hey, have you done a chest tube before and you've never done one? Don't say yes. Don't go do it. If you don't feel comfortable, say doing a face slack. That somehow ended up being like my thing that I had to keep doing on one of my rotations was face lacks. And at first I was a little bit nervous because it's, someone's face. I didn't want to leave them with a gnarly scar. So I just said, hey, you want to come like watch me do it? I haven't done a face lac yet. Like I feel confident in my suturing abilities and I've done other lac repairs, but haven't done one on the face. So I just want to make sure like it looks pretty. Can you help? And they would much more appreciate that than you doing something that you're not comfortable with. And finally, be helpful. Like I said before, your job is also to make the residents' lives easier. So if that's something as easy as you're about to go do a central line, go get the central line kit for them and help set it up. If someone wants a sandwich, if a patient wants a sandwich and you hear it, you're with the resident, like going to see a patient or something, and they ask for something, just tell the resident, hey, I will go get it for you. Do whatever you can to be helpful for everyone. Emergency medicine is a team sport. So you are working on the team and you're also trying to make yourself look good. So we've made it to the patient encounter. You're going in to see your first patient. Prior to going in, do a quick review of the patient's chart. I typically would do something just like see if they've been in the last month or so. Like, have they been to the emergency department? What do they have a past medical history of? Like, what am I kind of walking into the room to? Just to give yourself a brief idea. This isn't internal medicine. We're not doing a deep dive into their chart yet. Just a quick overview. And see if the nurses have written down anything because those notes are so helpful. So what have they said about the patient so far? Check their vitals. If vitals aren't in, go into the room and see if their vitals are on the monitor. If they're not hooked up to the monitor, hook them up to the monitor. That's a great skill to learn. And some rotations require you to have practice setting people up on the monitor. With that, let me back step for a second. Some rotations will give you a list of things that you need to do. Like some of them say start 10 IVs, start 10 ultrasound IVs, hook 10 patients up to the monitor, assist with a couple chest tubes, do some lac repairs. So you might be getting a sheet of things to do. So knowing how to set people up on the monitor is great for life and for the rotation. But checking the vitals are vital, so you're going to want to know them. Biggest thing in emergency medicine is sick or not sick. That's what you're walking into the room looking for. If your patient is sick, like they are crashing and you can't handle it by yourself, call for help. Go get your attending and your resident, pull them in. You are not equipped to handle that alone. Even if you have some past medical experience, EMS, you're a paramedic, whatever it is, in this setting, you need to go get your superior. So if they are sick, step out for help. Now we're at the history and physical. You guys know how to do this, your OPP, QRSTA, all that good kind of stuff, but keep it pertinent. The difference in emergency medicine and how we take a history and physical compared to other specialties is that we are very focused with it. We're not trying to get a huge clinical picture. We're trying to figure out what can kill you, and am I concerned that you might have one of those things, right? So we're keeping it focused. We're not going down rabbit holes, and you're redirecting your patient if you have to, because you're trying to keep this encounter 10 to 15 minute max. You want to be in and out of that room. Obviously, there's sometimes where as the med student, that is the beautiful thing, that we can spend a little bit more time in the room than otherwise, than maybe the residents can, but you do want to keep it brief, and then you're going to be going back in the room to see them over and over again, so you will have plenty of time to spend with the patient. Also with patient encounters, one thing you have to remember is that a lot of times patients aren't thrilled to see the med student, and you have to figure out how to advocate for yourself to still have their management. So for me, a lot of times what I would do is just say, hey, I understand that you think you're only seeing me, but don't worry, you're actually basically getting triple coverage, because I'm not only going to tell my resident about you, but I'm also telling the attending about you, and everyone has to lay eyes on you. So you're going to get so much more interaction with providers than you would have otherwise. And say, of course, if they really don't want to see you, pick your battles as you will. And then, I had some where I just said, I totally understand. I will step out and let somebody else see you. don't take that as an ego hit. Some patients just don't want to have to, tell their story multiple times. I can definitely understand why that would be frustrating because they've already told it to the triage nurse and their nurse, and now you and a resident and an attending. So that's a lot of time to say the same thing over and over again. But, right time and place, if you're with the right patient, you can also crack a joke about it and say, hey, I'm sorry, you have to tell this for like the fourth time now. You got a couple more times to go, but that just means we're really going to know what's going on with you. So the presentation, also pulled from EMRA. Here is a beautiful outline of their patient presentation guide, which is online that you guys can download. It is really, really great and helpful, but I'm also going to walk you through it right now. So the presentation is incredibly important because you have to remember your attending may not have time to go see the patient imminently, right? They are relying on you and trusting in you that you're recognizing whether they're sick or not sick. And that dictates where they are in their mental triage, right? You want to go see a patient, they're not so sick, and we have a trauma coming in, your patient's probably not going to get seen for a while, right? So all they have to go on is what you are telling them. So with that, you want to be organized, thorough, and focused. The same way we were in the room is the same way we're going to present the patient to the resident or the attending. You want to keep your presentation to 3 minutes or less. Emergency medicine, we have squirrel brain. We don't have the mental capacity to try to sit there and listen to a long presentation that rambles on for no reason. So 3 minutes or less. Seems like it's pretty quick, but with this next 8 steps, you will see how to get there. So this is pulled off of the EM Clerkship podcast. They do a fantastic job. It's about an 8-minute podcast with the 8 steps that I'm about to explain to you guys on how to get your presentation 3 minutes or less. I also have it tagged at the end under resources. You'll see that later in this presentation as well. So step 1 is your engaging summary, your demographics, your risk factors, and their chief complaint. That is pretty much self-explanatory. Demographics, their age, their gender, their risk factors, like if they're here for chest pain, have they had a prior MI? Do they have a family history of a heart attack? What is pertinent to their chief complaint? And then their chief complaint, they're here for chest pain. Now you go into your HPI, your OPPQRSTA, or whatever mnemonic you like to use. Tell the story, but again, make it pertinent. You don't need to go off the walls on some things. Just keep it straight to the point. So the patient has chest pain. It started about 30 minutes ago. It's worse with exercise. It's better with rest. It is crushing. It feels like an elephant sitting on their chest. It's radiating to the left arm. It's a 10 out of 10. It started now, and they're also nauseous. Doesn't sound too good, does it? Short and sweet. Give 5 pertinent positive or negatives. This is your review of systems. So he does have some shortness of breath. He has not vomited, 5 positive or negatives. Vitals. So now we're kind of moving into the objective. So start off with your vitals and summarize them. You don't need to say every single vital in the sheet. Like you don't have to say their heart rate's 105, their respiratory rate is whatever, their SpO2 is whatever. Just say he's a little bit tachycardic, but otherwise everything is okay. 3 pertinent physical exam findings. So again, we're sticking with focus. You're here for a cardiac complaint. So you're going to listen to heart, you're going to listen to lungs, maybe you're going to check their lower extremities for edema. The 3 big things that are important, that's what you're going to include here. Now we're going into the differential diagnosis. This is the big switch from 3rd year to 4th year. Now we're going into a big differential, we're going into a plan, and then we're also giving a disposition. So for your differential diagnosis, say we're going with chest pain, what are we watching out for chest pains, and argue for and against them? Well, he's having some chest pain and it's exertional, so that does make me concerned for an MI, but he did recently have a cath, so it could not be. Could be a PE, but he's not really tachypnic and not feeling super short of breath, so need to rule it out, but not as concerned, and so on and so forth. So know what your differential is, but be able to argue a little bit about each one. And then we're going into the plan. So you can use the list mnemonic that you can see on the EMRA patient guide. We're going to go over labs, imaging, special tests, and treatment. And like I said, this next one is going to show treatments. So again, pick your mnemonic how you will and organize your presentation. You're kind of seeing 2 different forms of it right here, but they're here for chest pain. So what are we going to do? We're going to get a chest x-ray. We're going to get an EKG. We're going to get a troponin. That's your basic chest, chest pain workup, right? But so on and so forth from there. Do we need to give them aspirin? Do we need to give them a nitro? Do we need to put them on oxygen? I don't know. It's your plan, but be prepared to give all of that information. And then their disposition. This patient is a 60-year-old male and he has a heart score of 6. So we're a little bit more concerned. I think we're going to want to bring him in for further evaluation, right? With your plan and the special tests, that is one thing that I noticed that I got tripped up on a lot because there are so many special tests and that's not something we're used to. So you want to have that prepared for your presentation of what is their heart score? What is their CHA2DS2-VASc? There's so many and you're going to just have to pick up on them if you don't remember them as you go. The number of times that I would sit there and they'd say, what is their whatever score? And I'm like, good question. I don't know. And then I would go look it up and come back to them. And then treatment. So like I said, I kind of already mentioned treatment with the plan, but you can give the treatment here either way, but give a treatment, know your dosing, Google your dosing if you need to, or use UpToDate or whatever you need to. That EMER book I talked about has a lot of medications and doses in it too. So it is very, very helpful. If you did not do something, don't lie. Like I just mentioned about not remembering my risk stratification tools all the time. It is okay. You're a med student and you're going to get things wrong. And the pressure is going to be on for you. This is your sub-I. I know you are working for your slow, but in the grand scheme of things, you are trying to build your attendings trust because the more trust you have, the more they will let you do within your shift. So if you didn't do something and you said you did, and then they go into the patient's room and it comes up in conversation, that is a big red flag. And that is a big no-no. So if you didn't do something, if you forgot to listen to their heart because you were so nervous, that is okay. Say, I didn't do it, but I will go in there and I'll be right back and let you know. Don't cut out in the middle of your presentation. Finish the presentation and then go do it. So I saw the patient, I presented it, now what? The biggest thing, let the patient know the plan. You're still a patient advocate here. So go back into the room. If you didn't already, because, once you feel a little bit more comfortable, maybe you're in the room and you know the patient has chest pain and you're just going to go ahead and tell them that you're in there. Hey, we're going to hook you up to all the leads. You're going to have a bunch of stickies on you and we're going to get the EKG. We're going to get the chest x-ray and then we're going to check it out once those results come back to us and I'll come back and let you know. But always let the patient know the plan. Reassess while you're in there. How are they doing? And honestly, reassess again. Go in there as many times as you want because they're going to be happy to see a familiar face while they're in the emergency department. Nobody wants to be there, right? It is the worst possible place to be. Not for us. We love being there. That's why we're going into emergency medicine. But for our patients, it is. So being a familiar face, going in, do they need anything? Checking in on their pain. Every time I gave a pain medicine, I'd set a timer, 30 minutes on my phone, and then I'd go check to see how their pain's doing. And then every time I do that, go sit down. Dr. So-and-so, patient in room 12's pain is much better after we gave them XYZ. That looks great and shows you're taking care of your patients and that you're acting at the level of an intern. Work on your note. If you're doing notes, now that you saw the patient, you don't have another one, knock it out. Try to get as much done as you can right here, right now. Don't procrastinate it. You don't want to have a bunch of notes to do at the end of the shift. Be on top of it, get it done. Again, monitor for results, let the attending know. So you're waiting for the troponin's elevated, you get it back and you see it, let the attending know. It looks good to be staying on top of it. What I would do if I was waiting for something that was very important and possibly related to the disposition of the patient is on my sheet that I use to keep track of my patients, I would put watch for EKG and put like a blank so I could put a check mark if it came back in so I could see it. So keep an eye out for the results and let your attending know when they come through. That way you can move patients. Take advantage of any time to practice IVs, ultrasound IVs, and ultrasound in general. If you have some downtime, you don't want to just be sitting at the computer. You want to be doing something actively. So if you have a second and you hear that an ultrasound IV is called overhead or whatever the system is, they do it, just say, hey, Dr. So-and-so, I'm going to practice my ultrasound IV if that's cool with you, and then go do it. It looks like you're being proactive and trying to learn, and that is a great thing. And then ultrasounds in general, The best way to learn ultrasounds is to be hands-on and practice them. So if you hear that somebody needs an ultrasound, ask if the resident's free and you don't feel comfortable doing it, ask the resident if they could show you how to do it. But try to be proactive. Not annoying though. There's a good balance. And that's the balance you have to figure out for yourself as you're going through this. So be proactive, but don't be annoying. Another one, offer to do lac repairs since they're time consuming. Residents love that. Lac repairs can take a long time and you're the med student. Go do it if you feel comfortable and confident. And then also, like I said earlier, be helpful. Set up bigger procedure for the residents. If a trauma is coming in and you can help in whatever way you can, set up those procedures, be prepared. And I'll talk a little bit more about what to do in the resus bay in a couple slides, but just always try to do what you can for the resident. So a couple slides. Resuscitation bay. So you're always going to have some resus rooms, whether that is a trauma resuscitation or medical resuscitation. Sometimes they have different rooms for that, but they get very crowded and very chaotic. So knowing what to do and what your role is really important here. So if you have a trauma, there is kind of a shift away from fully exposing the patients with trauma shears nowadays, because you don't want to cut off their clothes and then not have clothes to go home with, right? That's not really cool. So now a lot of times you are actually trying to take better care of their clothes, but there are the cases where you do need to just shear their clothes off. So get you a good pair of trauma shears. It doesn't have to be Raptors, which are stupid expensive. You can get a great pair of trauma shears on Amazon for $10, which is what I did, and have your shears and ready to go. I also always kept a flush in my pocket, because the number of times during the chaos that you would just hear someone, whether it's a resident or a nurse, say, does somebody have a flush, and you can hand it to them, you look good. Be ready to do it fast if you're comfortable and allowed to. You usually are doing the fast exam during a trauma. Someone is. So if you feel good with it and they are on board with it, you can be ready to have the ultrasound probe in your hand and do the fast. Now, keep in mind that it does need to be done fast, even though that's not what it stands for. But you do want to be proficient with it, because all eyes are going to be on you. There's going to be a lot of people in the room, and you just got to be ready to move. And if someone else wants to do it and take the probe out of your hand, do not take offense to that. It is a-okay. It happened to me several times. Performing CPR. That is something that not necessarily a lot of people have done yet, but this is the greatest opportunity to do it, because it takes nurses off of that role. So jump in there, do CPR. It is very difficult. I will tell you that. It is a lot more tiring than you think it is. If you've never done CPR before, it is very aggressive. It is uncomfortable. If you need to step back, by all means, also go ahead and step back. If you're not okay at the end of the code, it is okay to ask to take a minute. It is okay to talk to your residents about it. The first time I did CPR, it was on a sub-I, and a lot of people were not okay after it. I was really, really fortunate that my attendings took everybody outside. We actually walked out of the ED into the EMS bay, and we took a second, and they just did a mental check-in with everyone to make sure everyone was okay. And I really, really appreciated that. So it is, a code is a difficult time for everyone involved, even if you've been doing it for years, and they all hit differently. So it is okay to ask for help. The other really great way you can be involved during a code if you're not doing CPR is to have your hand on a pulse, because pulse checks come around and it's a lot more convenient for you just to have 2 fingers on a FEM and say yes or no than everyone like scrambling to try to find a pulse at a pulse check. And then the other thing you can do is stay out of the way. That is the biggest thing. They don't want the med students in the way. There's a lot of moving parts. So if you just need to stand back and watch, if you're not comfortable to jump in on it yet, that's also totally okay. Stand back for a couple and watch the flow of things before you jump in. So, is optional optional? So you're invited to journal club. You're expected to attend didactics. You're offered to go to drinks after shift, or you end up on a party boat like I did. I am in that photo on the bottom right. Go to the optional events, because you are trying to bond with the residents. You are trying to get them to know you. You want them to advocate for you. You don't know who's going to be at what event. You don't know who you might impress at journal club or after an after shift beer. of residents have a lot more say in who gets to come to their program than you think. I was very fortunate to make great relationships at a lot of the places I rotated, and a lot of them, advocated for me to be higher on their rank list to their program director because they got to know me. So you never know who is going to be there. Obviously, if there's alcohol involved, be smart. Don't get sloppy. Have a drink, drink water, whatever you have to do. We're adults. You know how to handle yourselves, but I would say go. If you really can't, they will absolutely understand. But I think it's a great idea to get plugged in. You're there to see how the residents interact on shift and off shift, right? Do they really like each other? It's really easy to find out if they're hanging out and you're there. Study resources. A lot of rotations, you might have to take an exam. I took an in-house exam on my first rotation. I took the SAEM exam on my second rotation, and I took the MD shelf exam on my third rotation. So you're going to have exams. I had quizzes on some of my rotations. There was a lot of work that had to be done. But these are some of the resources that I used that were extremely helpful. So the EM Clerkship podcast, you can listen to that in the car. Same thing for EM Board Bumps, EM Over Easy, and Core EM. Those are all fantastic podcasts. Rosh Review is what the residents use to study for their ITE, their in-training exam. They do make a med student emergency medicine deck. Some rotations will provide that for you. I was very fortunate that some of mine did, so I primarily used Rosh Review, and it was incredibly helpful. Very difficult questions, though, different than what UWorld and TrueLearn kind of looks like. They're supposed to be challenging, though, so you really, really learn from them. Highly recommend. I went through all of Rosh Review, the fourth year questions during my sub-Is. Of course, you can do UWorld and TrueLearn emergency medicine questions. Then you can find the SAEM exam flashcard deck on like Quizlet. That is fantastic for help too. And then of course, use your King for emergency medicine. After you finish the rotation, make sure you finish any assignments you have. So like I mentioned, I had some quizzes. There was some rotations where I had to do a blog post every week. And then if you're on a core for your school, you might have school assignments too. So make sure you finish your assignments. Submit your school's grading form to the clerkship director if you haven't already, and then thank the clerkship director. So I usually did that together. I'd wait till the end of the rotation to send my school's grading sheet, but also wrote a thank you note with the email with my grading form. And then while you're on your sub-Is, don't forget to be working on your ERAS application. There's a lot going on, but you don't want to procrastinate ERAS until August, September, because it is very involved. So start working on your personal statement. Join us May 9th, shameless plug again, for our next series on writing a baller personal statement. Work on your experiences. I know they brought hobbies back in. That is so exciting. So round up your hobbies and get ready to do that. And then go crush your next sub-I. You finished one, you've got another one, and you're going to absolutely rock it. You can scan the QR code. Let us know what you want to hear about for future lectures. But if you have any questions right now, I will open the chat, and feel free to come off the mic and turn on your camera and we can talk. But thank you guys so much for coming. I hope this was helpful.